All right, now we're going to talk about a few instruments and how they're used in the patient mouth. So first we have our mouth mirror. Okay, so this mouth mirror is used intraorally. And this mouth mirror, we'll show you how it's used here in the mouth. So it can be used to reflect light. So if you're doing it on the lower incisors, you can kind of reflect the light. If you're doing the maxillary, it can be used for indirect vision. So to look at those teeth, indirect vision. And it also can be used for retraction. So you can retract, and you always want to retract with the flat side of the mirror, not the side of the mirror that has the handle on it. Okay, and other side, we flip the mirror over and we retract here. Now, if there was a tongue, we could retract the tongue. Perfect. All right, so our next instrument that we're gonna pair with our mirror is gonna be the Explorer. And there's all different types of Explorers, but the Explorer, you can tell it's an Explorer because it's pretty sharp on the end here. You can see that, it's a nice point there, okay? So Explorer has quite a few uses in the mouth. Most of the time the dentist uses that to do an exam and to check for decay. So they can put it on top of the teeth and tell if the enamel is soft, which will tell you if there's decay. Sometimes we use it during fillings or things like that to kind of clean up our margins. And you notice she has a fulcrum holding the Explorer in there, and then she's retracting with the mirror. Good. All right. Our next instrument is going to be a Periodontal Probe, which the Periodontal Probe here, you can see on it, it has some markings. So a Periodontal Probe is used to measure the pockets in the sulcus. Okay, so each one of those lines represents a number or how deep the pocket is. All right, let's show you how to use that. We're going to do that in the anterior here. All right, so we're gonna put that right down into the sulcus here. Good, good, and good. So that's a periodontal probe, okay? The next one we have is a spoon excavator. So a spoon excavator has a little, if you will, a spoon on the edge, and it has two different ends, so you see? Right there's the spoon. So the spoon is used kind of like a handpiece is used to help remove, it can help remove decay that's down in the bottom of the tooth. And it has that little spoon on there so you can kind of scoop with it. We're scooping out that filling material in there. Good, all right. Our next instrument is going to be a condenser or a plugger. So this one, you can see that the end is kind of blunt. So that helps to pack down in material or condense material. And they come in all different sizes. So it just depends on what the doctor likes or needs for the area they're working on. So this is going to be used to pack down. So you kind of push down on this one when you're using it. And it packs material down in there. Perfect. All right. Our next one is a football burnisher. This one's pretty easy because you can tell it's a football. Kind of looks like a football on the end there. Okay, so it's double-ended, has two ends. It looks like a football. And it's a football burnisher, so it's used to burnish or smooth material in the mouth. When we do like amalgam or temporary fillings, things like that, we use that to smooth that material down. Good. Football burnisher. The next one we have is called a Woodson. So this one has a condenser or a plugger on one end. And on the opposite end, I always call this a hockey puck, kind of like a flat end there. And this is good for, the hockey puck end is good for carrying material over, putting cement into a temporary, and then of course we have the condenser. So let's use the paddle end. Paddle in there. Good. And then if she wants to condense, she can just flip it over and then she can condense in there. Good. So that's a Woodson. All right. Our next instrument is called a half Hollenbach. So this one is a inner proximal carver. You can see it looks like a little spear. It looks kind of sharp. So that's a carver. So that's the carved material, inner proximal, which is in between the teeth. All right, let's look at it in the oral cavity. So that's inner proximal. She's going to use to carve in between the two teeth. Good, and then on the distal. Good. All right, so let's talk about cotton pliers now. So we have cotton pliers. These guys are used to transfer items into the mouth. They're used to remove items out of the mouth. So we're going to show you how to use it on a cotton roll. So if we're placing a cotton roll, we're going to pick up the cotton roll. Perfect. There we go. Good. So the cotton roll, and if you notice, let's look at her cotton roll here. So she has it where the sharper part of the cotton pliers is not going to poke the patient when we put that cotton roll in. So we're going to go in, we're going to retract in the vestibule, and she's going to place it in the mouth. Perfect. Now when we remove, we're going to go back in the same way. Back in, grab that cotton roll, and come out. Alrighty, that's some instrumentation for you. So again, we have the mouth mirror, the probe, explorer, spoon excavator, condenser or plugger, football burnisher. We have the Woodson, a half Hollenbach, and the cotton forceps or cotton pliers.